Hi everybody, it's Nigel Denby, menopause dietitian. I am waiting for our lovely menopause doctor, Dr. Zoe Schaedel, to join me, and then we will get running with session 2 of, here she is, session 2 of our very own we are going to be talking all about HRT, which is right up Dr. Zoe's street, and here she is. Good evening, Zoe. How are you?
I'm well, thanks, Nigel. How are you?
Jolly good. I'm really good, thank you. Where has a week gone?
Flown by.
Crazy. Busy, lots of sunshine, lots of rain. And but it's great to be back and lovely to be talking again with you. So just a reminder, I'm menopause dietitian, I'm Nigel, and this is Dr. Zoe Schaedel, who is a menopause specialist GP, and we work together over on Harley Street at Home, which is a free Facebook community supporting anybody who is interested in the menopause. Last week, we talked in general about menopause and kind of gave an overview and an introduction to things. Tonight, we're going to sort of sit in your specialist area, which is hormone replacement therapy. And I guess really where we ought to start is actually even just thinking, well, what is it? What is HRT?
Brilliant. So I suppose HRT is so important to talk about because of all those things we talked about last week, the symptoms of perimenopause and menopause. So we talked about so many things that happen in the body from top to toe. People can experience a whole assortment of difficult symptoms at this time. And what they are due to is a lack of hormones. So our estrogen from our ovaries, the production drops over our lifetime, but particularly in the 40s for the average woman leading up to that last period. And when the estrogen drops, all of those symptoms can arise, a whole assortment of things. And when we're talking about HRT, we're literally saying, let's replace the hormone. So hormone replacement therapy. It's so important because I will talk about it in detail, but I think it's important to say it can be very effective. So we're literally putting back into the body what has been lost, what has dropped. And also it's important to talk about it because we know there are lots of myths around HRT, aren't there? So many confusions. And we've had loads of questions from the We Are Fit&Well community. So thanks so much for that. We're going to try and answer all of them.
Brilliant, guys. Yeah. Thanks. Yeah, thank you for the questions.
Brilliant. But so for most women, what HRT means is replacing estrogen. So that's the hormone that has the most significant effect on symptoms. It drops in the, for the average woman in the mid 40s or early 40s and causes all these symptoms. And what we want to do is put it back in. Now, we can do that in all sorts of ways, but we're lucky that some of the old-fashioned HRT formulations that were synthetic, that were associated with risks and side effects sometimes, we've now got much better things available to us. So we have natural products that we call body identical. And usually estrogen is used through the skin. And so we're literally replacing the estrogen that we've lost. Now, for women that have got a uterus, so if they haven't had a hysterectomy, they will also need to have a progesterone. And the progesterone is a kind of balancing hormone. It's not necessarily there for symptom control. It helps to protect the lining of the uterus from the effects of the estrogen. And then for some women, again, those things, the balance of those two things might not be enough for symptoms, and you might want to add in a third hormone, which is testosterone. So that's HRT in a nutshell, Nigel.
Should we go home?
Yeah.
Okay. So there's lots of different hormones.
Yeah.
Sounds like you can take them in lots of different ways.
Yeah.
What I think, I mean, again, for, I know a lot of the women that are part of the Fit and Well audience are in their 30s, their 40s, maybe even thinking menopause is something that's a way off. And actually, you know, very often it's women in their early and mid 40s where you might start noticing some of these symptoms. And I mean, just it's useful, I think, probably as a reminder from last week to remember the way I always think about it, and I think, you know, you've summed this up so nicely, is that, you know, estrogen is that hormone really that makes you female. So it's perfectly reasonable that you might experience symptoms that kind of go from the top of your head to the tip of your toe. We're not just talking about hot flushes, which are the things that everybody thinks about when it comes to menopause. And so women should really be looking for changes, just things that don't seem how they would normally be. And that might be physical, it might be emotional, it might be sort of cognitive, how you're thinking and concentrating. So don't ignore things, is the start, I guess. But then if you are going to think about HRT, I think it's reasonable that a lot of women might think, well, that's what you have to do once your periods have stopped, once you're menopausal. And I mean, that's not going to happen for years. So when do you start thinking about HRT?
And I think that is a real myth, that people think that perhaps they need to wait till their periods have stopped, or that their symptoms need to be really severe. And actually, neither of those are true. So really, HRT is available for anyone with any symptoms of the menopause. And so really, if you're noticing things that are meaning that you're affected in some way, that, you know, something is a little bit harder, perhaps you're more anxious, or you're not functioning as well at work, or, you know, that you're feeling that you're aging in a way that doesn't feel good, you know, skin and hair changes, changes to the way your body feels. All of those things are reasons to consider replacing hormones. And I suppose it's not something, I think there's a myth that sometimes it's something that needs to be held back kind of for when it gets really, really bad, in a way that people sort of think there might be something harmful about it or wrong with it. And in fact, the complete opposite is true. And in that, when we do replace the hormones, we're actually helping our bodies hold on to that youthful estrogen that helps us in so many ways. So it's certainly, what I would say is, if you are experiencing symptoms of the menopause, now is the time just to consider it as an option and know it's there and understand what it could do for you. And I suppose that's in line, we're really lucky actually. There are some amazing guidelines, clinical guidelines from NICE, which is the National Institute of Clinical Excellence. And they've given some brilliant guidelines on the menopause. And they say exactly this: for a woman in the perimenopause, so before the periods have stopped, if you are experiencing symptoms, they should be offered hormone replacement therapy, and they should be told about the benefits of that, as well as any risks. And they should have the opportunity to consider that.
Wow, could we get that tattooed on most GPs' foreheads, please?
Yeah.
So that, because of course what we hear so often is ladies being told by their GP, and we touched on this, well, we talked a lot about it last week, this idea of GPs saying, well, you know, you haven't stopped your periods yet, so we're not going to think about HRT, which is really a very outdated view of how to manage menopause. So we're talking about benefits, though, on top of symptom relief. And I think, you know, again, the most important thing is this is designed to allow you to function, to feel well, to feel vital, to feel as well as you deserve to feel. I don't know about you. There is sometimes, I think, this perception that, you know, real strong women get through menopause, you know, without any intervention at all, and almost like it's a failure to give in to HRT. Let's just actually put some logic into this, because what are the benefits? Never mind symptom relief. What does HRT do as a health benefit?
Well, I suppose we've got to remember that our bodies weren't really designed to live without estrogen. So actually, you know, we used to have a life expectancy that almost was identical to the age of menopause. And so, you know, we were actually going to die at the point of menopause. And, you know, there's been so many amazing advances in healthcare and the way we live that means we can now go on and live a huge percentage of our life after the menopause when our estrogen have dropped. But that means our body does suffer from that. And it's not just symptoms. So as soon as our estrogen levels drop at the time of the menopause, it affects different systems of our body, but particularly our bones. So our bones start to weaken, start to become thinner. And 1 in 2 women will develop osteoporosis after the menopause if they don't take HRT or they don't replace the hormones. And so, I mean, that's a huge thing. It can lead to fractures and lots of problems in later life. And again, the cardiovascular system, as soon as the estrogen drops, up until the estrogen drops, we are doing so much better than men. Sorry to say it, Nigel. You know, the women have got a lower rate of cardiovascular disease, lower rate of heart attacks, lower blood pressure, everything. And that's all due to the estrogen keeping our blood vessels lovely and flexible. And then the estrogen drops at the menopause, and almost immediately our risk of cardiovascular disease catches up to men. And so you're thinking about the benefits of HRT, and that it's all about that. So firstly, symptoms make you feel good, make you enjoy this phase of life that you're going to be in for a long time, hopefully. But secondly, we can protect our bones. We put the estrogen back, we make them strong. And also the cardiovascular system, we reduce the risk of cardiovascular disease by about a half for women if you start HRT in the 10 years following the menopause. So unless you're starting it very much later in life, it has a huge benefit on the cardiovascular system. Also helps with metabolic things, reduces the risk of type 2 diabetes and, you know, and all sorts of things, dementia.
Do you know what? It makes me always laugh. If I'm in a menopause clinic and a lady comes to see me to tell me, you know, I've spoken to the doctor and I don't want to take HRT. I want to do this naturally. And then she'll also say to me, so, you know, I'd like to do it with my diet. And of course, the reality is, I'll always say, you know, actually, your diet isn't going to, if you've got symptoms, your diet isn't going to change those symptoms. You know, that just is a myth to suggest that it will. And you might want to take all kinds of herbal remedies, but the evidence supporting a lot of those is not great. And actually what I end up saying is, look, you know, if you're not going to take HRT, first thing I would suggest is your symptoms probably aren't that severe anyway, because I see women who are on their knees with symptoms and would take anything to feel better. But actually, more than talking to you about symptom relief, I need to talk to you about how I'm going to try and stop you having a heart attack and how I'm going to protect your bones. Because if you're not taking HRT, actually, that's my biggest worry, is your heart and your bones. And, you know, again, I think you're so right when we say it's only the last few 100 years that women have lived long enough to experience a menopause. You know, I think it sometimes feels like nature messed up. Nature never meant for us to live this long. You know, and if we are now in a position where better nutrition, better medicine, better healthcare means we can live into our 80s and our 90s. There are some things that we kind of need to do to take some responsibility for the quality of those years. And, you know, let's not forget, if you're going to live into your 90s and beyond, the chances are you're going to spend more years as a menopausal woman than you did in your fertile years. So we can't just brush those under the carpet as not relevant years.
No, and that, there's stuff people can do that is not HRT that can make them feel better for sure. So, HRT isn't the only thing you can do, and you can make yourself feel better with exercise and managing stress, and if you can improve your sleep and all sorts of things, they can help you feel a bit better, but they won't have those other benefits of health, prevention. And I think that's really important when people say, a bit like you, when people say, I'd rather do it naturally. I always think, well, okay, that's completely fine. Everyone's got to have the option as long as they understand those benefits and the risks. But do they know that actually, you won't get those health benefits from alternative treatments and supplements and things like that? And also, often those things haven't been studied as in detail as the hormones that we have available to us, which are regulated, and we've got really good evidence about their safety. And sometimes we don't have that for other things, so it's just worth knowing there's a spectrum of options, and it's just making sure really how to weigh these up for you.
But let's get real, and let's also look at the other side of it, because I fully understand a lot of women are nervous about HRT because they've read that there are risks to taking HRT. Let's look at that side. So what are the risks? And I guess the biggest one being, I'm going to get breast cancer.
Absolutely. And we've got to talk about this, haven't we? Because every conversation about HRT has to talk about breast cancer. We have heard it in the media for so many years. It's been such a big thing for people. And there is a certain amount of it that is a myth. And it's worth trying to really go into that for people. So it started about 20 years ago, and there was a large trial in America called the Women's Health Initiative. And the trial, it was a really big study looking at lots of women taking, usually a more old-fashioned sort of HRT, but taking HRT and comparing them to women that didn't take HRT. And suddenly they decided to publish this data without fully going over it, without fully analysing it in a way that normally studies do. And they put it out to the media and said, actually, we're showing here that women are going to have an increased risk of breast cancer and strokes on HRT. And they told people you must stop. And, people were literally on breakfast TV saying, everyone, stop your HRT now. This is dangerous. Yeah, absolutely. And really, so there's been lots and lots done since that time to look back at that data and really work out that it was not all as it seemed. But it created huge fear for women. People stopped taking HRT in their droves. And really, the effect has lasted for a whole generation have really missed out on this opportunity. And what they've found now when they look back at it, so there's been lots of people looking back at that data, and also some new studies to see, is this really right? And that in part has triggered the NICE guidelines, actually, and they talk a lot about this, which is, firstly, the data wasn't represented quite correctly. So first of all, women that were taking estrogen HRT without a progesterone, in fact, had a lower risk of breast cancer. So rather than standing up and saying, it is estrogen, it is a baddie, you must all stop. Actually, they found that women that were taking estrogen, so if they'd had a hysterectomy and they didn't need a progesterone, it was actually seen to have a protective effect against breast cancer.
Totally the opposite.
Yes, so no, I don't think that was ever mentioned at the time. And so again, that it brings into think, okay, what is causing the problem here? And so firstly, we now have seen that in other studies. So if you take estrogen alone, you do not have any increased risk of breast cancer at all, possibly a lower risk of breast cancer. Okay. And then they've also said, and actually the figures weren't represented correctly. It was sort of presented as a huge risk of breast cancer. And in fact, when women took estrogen and progesterone together, they did see a very small increased risk in breast cancer. But as the NICE guidelines say, you need to put that in context. You need to say, but also what about the protection for cardiovascular disease and bones and all those things you're more likely to experience? But also, there are other things women do every day that have a similar sort of risk. And you need to know that. So things like
Which
drinking a
falls
glass
so
of
much
wine.
into my clinic.
Yes,
Because what we know is if you're overweight, the risk of breast cancer is much higher than it could possibly be, anywhere near be from taking HRT.
Absolutely.
If you drink too much alcohol, and too much alcohol is not a lot, actually, couple of glasses a night, if you're having that most evenings, that's increasing your risk of breast cancer much, much more than taking HRT. And also, if you're inactive, which the vast majority of us are, that has a significant rise in your risk of breast cancer as well. So I think, as you say, what we've got to do is really present this to each woman to allow her to make the choice that is right for her. I know you and I often sound as if, you know, we're banging the drum of HRT all the time. And I think that's because we know it's been so negatively presented, and we really want to redress that balance.
Absolutely, yeah.
But if a woman doesn't need to take HRT because she's having no symptoms, nobody's going to force it down, force it upon her. But I can't bear the thought, and we know that this is the case, that there are literally thousands of women struggling to get through each day, believing that they shouldn't take HRT because it's harmful. Or worse, there was a lady there, Sharon, was telling us that she went to her doctor about menopause symptoms and was sent away with antidepressants, which we hear all the time.
Which aren't going to work for your symptoms. We know that for most women, and also aren't going to help you protect your future health. So it is so frustrating because you're missing out in so many ways. And just, again, Nigel, all those things you said are so true. And it makes me think, again, when you're thinking about giving someone HRT in the context of all these risks, and the thought that someone feels really fearful about it is, you know, it's really upsetting. But actually, if you feel better, if you've got HRT and you feel better and you've got more energy and you're sleeping better at nighttime, the chances are you're going to exercise more. You might lose some weight. You're actually likely to live a healthier lifestyle, reducing your risk of breast cancer. And so it is, you know, it's so important. Women are often really limiting their enjoyment of life. You know, some women don't drive because they feel so anxious. Some people have, there was a study that said a huge percentage of women have either left their jobs or reduced their hours at this time of life. And, you know, all of those things are really significant. And if you can do something that helps you make the most of this life, it's likely that you will be thriving and that you will have a healthier lifestyle anyway. And I see that all the time in clinic. The other day, I saw a woman who had joint pains everywhere, absolutely everywhere. And she'd been investigated with scans and all sorts of things. And I did her review, and all of the pain had gone, and it was an amazing response with HRT. I hadn't even expected it to be so good, but of course she'd then started exercising, and she was enjoying life so much more. It can have a huge impact on your health.
Do you know, just last night, I'm running, as you know, my Back to Basics. They're a 12-week weight management program specifically for women in menopause. And I screen each woman before I let them into the program, because so at the minute, my new class has got 9 women in. I probably screened nearly 50 and ended up with 9 and the biggest reason for saying to somebody, yes, do the program, but come back to me, is because their symptoms are untreated. And I know, I've been doing this for 25 years, Zoe, I know they will not be able to make the changes to their lifestyle if they are bogged down with uncontrolled symptoms.
Yeah.
And, you know, we even saw it, I think one of the most striking things in Davina's documentary just last month was, I mean, I forgot this stat, but it just blew my socks off, that out of menopausal women, only 1 in 10 is taking HRT.
I agree. It's a stunning statistic. And when it sounds as though we are, you know, talking about HRT in this way, it's really to say, it's not to say everyone in the world should have it, but it's like, please know it is a brilliant option. And if you are struggling, it is there. Even if you are not struggling and you want to do something to help your future health, you know, discuss it with a doctor who knows about the menopause. Ideally.
Absolutely.
Yeah.
And that will usually be a menopause specialist doctor. Now, what about, though, isn't this just tricking nature? And the minute you stop taking HRT, those symptoms are going to come back like a steam train and smack you on the back of the head. No. Is that what happens with HRT?
Yeah, so sometimes people think it kind of postpones the inevitable. You know, it holds back those symptoms, but it doesn't at all. You will have menopausal symptoms going on for as long as they're going to be going on for. And if you take HRT, you resolve that all the time you're having it. So if you were intended to have symptoms for 5 years, as some women are, and you took HRT for 7 years, you would miss out on those symptoms. So it doesn't postpone anything. You don't get a kind of build up of symptoms at the end. And again, there's no time limit with HRT. You can take it for as long as you like, as long as every year you discuss the benefits and the risks and make sure that it's what you want to do. So plenty of women will want to be on it for the rest of their lives, and certainly into their 60s and 70s, much more commonly now, because, you know, it's helping them feel well and protecting their health.
And I think it's reasonable to say that, you know, the expectations of a 60 and 70-year-old in 2021 are very different to what they would have been in the 1980s even. You know, this is now we are entitled to a really full, active life right the way through. You know, the issues that generally will give us poor health in our later years are lifestyle conditions, and they are conditions that are very often preventable if we make different choices about how we eat, how active we are, how much we drink, how much we smoke, how we use our brains. And conversely, if you are expecting a human body to live without a hormone that is absolutely critical to its very being, then you might well want to rethink, is there something I can do about that? I mean, when you think about the massive growth that we've seen, the explosion we've seen in the last 10 years for cosmetic procedures, and but then we will see the very same women not wanting to take HRT because it's not natural. You know, and actually, I mean, my goodness, you know, anyway.
Totally. Now, I think the We Are Fit and Well community had quite a lot of quite practical questions about, you know, if you are thinking about HRT, what is involved? You know, what would it be like to start HRT? Maybe you've got some symptoms. Hopefully you're not feeling too awful. But if you are, or even if you've just got mild symptoms, what would it look like? So as I mentioned, it's estrogen that's usually given through the skin, and that's because you don't have any risk of blood clots that way. The old-fashioned HRT, when you swallowed it through the mouth, there was a slight increased risk of that. So it can be given as a gel, a patch, or a spray, and it's usually something that you use every day if it's a gel or a spray, or a patch that you change twice a week. And then if you need a progesterone as well, there's a sort of newer body identical progesterone that comes from plants, and it's exactly the same as our own progesterone. It's safer, so it's got a lower breast cancer risk than the old-fashioned hormones that those studies were based on. And you just take the progesterone at night time usually. Now, how you take it will depend if your periods have stopped or if they haven't. So if the periods haven't stopped, you would tend to take it in a kind of cyclical way where you would have a bleed each month for the first couple of years, and then you can move on to having it just once at night and you wouldn't have a bleed. Testosterone, again, that would be something you would tend to think about if your symptoms hadn't resolved after being treated with estrogen and progesterone, and they often do resolve like that. But if you still have a low libido, low motivation, low muscle strength, that type of thing, brain fog, then sometimes testosterone can be helpful, and that can either be given as a kind of cream designed for women, or sometimes available as a kind of male product as a gel, just in small doses. You just need a little bit. And yes, so I think that's kind of the overview of how you would practically use it. A lot of people asked about how long it took to get rid of their symptoms.
Yeah.
And it varies, but with hormones, 3 months is always the rule of thumb, because you need the levels to come up a bit. Some things can go quite quickly. So often within a few days or a week, hot flushes and night sweats can improve, and that's such a relief. But some things take a little longer. Sometimes the mood symptoms in the second month. I tend to find joints are a little bit later on, and sometimes hair and skin, because things have to change over time. They tend to come a bit later, towards the end of that 3 months. But by 3 months, most women will have noticed a significant improvement in their symptoms.
Okay. And so on average, I mean, I don't know if you've done an audit of this or not, but out of what rough percentage would you say of women get it, that you're getting it not right, but the HRT mix, the formulation is unchanged for them, and how many probably need a tweak and an adjustment?
Yeah, that's absolutely right. So at 3 months, I would say more than 50% we will need to tweak. So sometimes you hit it, straight away, you just get it right. But actually, we always review women 3 months after starting HRT. Whoever prescribes your HRT, you will have a review at 3 months. You should have a review. And at that point, you say, are your symptoms better? Are they resolved? Are you having any side effects? Are there any problems? And if the symptoms aren't resolved, often it just needs the dose to go up a little. And there's other things that you can do. You can change the way you use it and all sorts of things. But of course, one size doesn't fit all. We're all different. So, you don't want to just send someone away and say, that's it. That's what's going to work for you. It's not like that at all. You've got to individualize it.
So really, it's like getting a really well-made tailored suit. It's got to be made absolutely right for you, and that's your skill. Is if somebody comes and says, well, my sweats and my flushes have gone, I am sleeping a little bit better, but I've still got no libido, and I'm still exhausted even though I'm sleeping a little bit better, and I'm still just not me. You know what to jump in with and say, right, so this is how we might tweak it and adjust it to fix that, which I think, again, I do still see so many women who have been given one combination, packed off with that, and never really had that reviewed again, which this is quite complex. It's not, as you say, just a one size fits all.
It's a shame when that happens, because there's so many options nowadays. We've got some brilliant products, and women do absorb really differently. What we know is that one woman will just need a certain dose of a patch and feel wonderful, but another woman wouldn't suit her, and she would like a spray that absorbs differently. So you do have to play around with it a little bit sometimes, and that's completely normal. And I suppose it's also worth saying that we are talking in very general terms, particularly about women that go through the perimenopause or the menopause at a kind of average time, early 40s to 50s. But some women will have a much earlier menopause, and HRT can look a bit different. There was a couple of questions about that. And if you do go through the menopause earlier, actually it is so much even more important to have HRT, because your risks of developing osteoporosis and heart problems are greater because you're without estrogen for longer. And sometimes you need higher doses of HRT in those situations. So make sure, if that is you, you are speaking to somebody who is a specialist in that area. It's really important. And there are a group of women where HRT isn't the first line as well. And really, so not many, most women, it is completely safe for, and it is the first line treatment. But women that have had breast cancer, in particular estrogen positive breast cancer, it isn't thought to be the first line because there is a small additional risk of recurrence, which obviously is, you know, you're trying very hard to avoid a recurrence of breast cancer. And so in that situation, it's not that it's a no for everybody, but you would want to try other things first. So there are some other things that you can do, that may not have quite the same benefits, but can be very good. And if they didn't work and you were still struggling in that situation, please do speak to a specialist, because nothing is off the table. You know, you will consider everything and talk about those risks for an individual.
Again, I know, I'm sure you've seen women. I know, you know, women in my classes who have actually had breast cancer have still gone on and taken HRT with very careful supervision and monitoring from it. And I think, again, that's the thing. Everything we are talking about is pro-choice.
Yeah.
And with the right support from a well-trained specialist in this area, you work with your doctor to make the choice that is right for you. Quick question I'm always asked in clinic is about HRT making you fat.
Yes.
Help me out. Help me out. What do I say to my ladies?
So there is absolutely no evidence that HRT causes you to gain weight. So the principles, we'll go back to them, is that you are losing estrogen at this time of life and we are putting it back in, and it is natural. It's the same. We're not adding in a medication, nothing like that. So, and in fact, more women that we see tend to, because of those things we said earlier, be more active, do more exercise, perhaps cut down some of the stress eating and all that sort of thing that they're experiencing. So lots and lots of women lose weight on HRT. Now, there is a caveat, which is I do sometimes see women that say, I feel like I'm gaining weight with HRT, and sometimes it turns out that it's actually a bit of fluid retention. So sometimes hormones, it's quite unusual, but it does happen on occasion. And do speak to your doctor if you think that's happening to you, because more likely it's the progesterone, not the estrogen. More likely it is. And there are different ways of using progesterone, and sometimes it just needs a tweak to the combination that you're on, and that side effect will go away. So there is no evidence that HRT will make you gain weight. It would be a much harder conversation that we were having if it caused women to gain weight. I think we'd be out of business. But
I think go on. I was just going to say, I think there's bags of evidence that menopause makes you gain weight.
Yeah, well, you said last week. I mean, how many people gain serious amounts of weight in
75% of women gain around 10 kilos during their perimenopause. That's a stone and a half. It's a good dress size. And that is all to do with the hormonal and the metabolic changes that come about. And just as we said, I know we're going to do a whole session on weight gain, but my view is, if you are feeling good and feeling on top of your menopause, we can sort your weight out. I promise you that, ladies. However, you have got to get feeling good first, because what you're going to need to do is adapt a lifestyle approach to this. And this is going to be something you will do for the rest of your life. And therefore, break free of the misery of yo-yo dieting. You'll stay in control of your weight for the rest of your life, but you've got to feel good first.
You're so right. And I'm so looking forward to, we're going to have a whole session on this, aren't we?
Oh, I'm plugging myself into the mains already. But before we do that next week, I know one of the areas that you're really specialised in, which is so brilliant, because it troubles so many women, is poor sleep and how to improve that. So we're going to do a session looking at sleep.
Yeah.
And just, I think really, I mean, you and I have done this session elsewhere on Harley Street at home, and I just loved how practical it was. I was expecting you to talk to me all about medications and prescriptions and drugs, and actually it was so lifestyle-y.
Good. I'm glad I surprised
brilliant.
you, Nigel. Good.
You blew me away. And
Yeah.
actually, you know, it's the usual thing. I mean, what I loved is it's so similar when I'm talking about weight. You know, it's not rocket science. It's all fairly straightforward, fairly simple things that if you mix them in and make a toolkit of them together, actually become incredibly powerful and incredibly effective. So I think that's going to be a cracking one.
I'm looking forward to it. There's a couple of questions on here. Maybe It was Juliet has said, if a hospital starts you on HRT after a hysterectomy, do they review it or is it the GP? Do you know, I think it's very likely to be the GP, unless you've got a surgical review for the operation, when they might mention it or they might not. Then it is very likely that gets followed up with the GP in that situation. And Kirsty Annalise has said, I'm 44 and has had 3 periods this month. Do you think it'd be worth speaking to my GP? Yes, do check that out, definitely.
Yeah.
Things can change and go quite haywire.
And quite often, I think, you know, I'll often see women that come in to my clinic, you know, lacking in energy. And when we start looking, that there's not a lot of iron in their diet, then we start talking and realizing, which is such a common thing, that actually during perimenopause there was some really heavy, long periods, which will, I mean, have a massive effect on depleting your iron status and can really leave you feeling quite washed out at the end of that. And just as you were saying about, you know, taking a while for HRT to kick in, it can take quite a while to bring those iron levels back up.
Yes.
And particularly if you're not going to do it with a supplement, which can often be quite troublesome on your tummy. So
yes, people don't always tolerate those well, do they? It's not easy. No.
So have we covered all the questions, do you think, that have been sent in? Because I loved it that people did that. So
yes, it was brilliant. Yeah, so I think so. A lot of people asked how long they would expect to see changes, and someone had said they'd had Sandrina and Provera for 4 months. Should they try something else? And what I would say to that is, you might not need something else, but do review it because it just needs tweaking. After 4 months, yes, you should have experienced benefit. And if you haven't, speak to your prescribing doctor because it probably needs the dose to be changed.
Okay.
We talked about breast cancer. How long is it before I get no more sweats on the patches? So again, often quite quickly, but up to 3 months before symptoms settle. How to get rid of migraines? We're not going to go to it, but you know, actually, if you get HRT right, they should help hormonal migraines. So it's all about keeping the levels lovely and stable. Sometimes a patch is a good way of doing that. If you're not using a patch, it might be one to consider because it's very stable. The difference between Tostran and Androfem is the female testosterone designed and produced in Australia, and Tostran is a male gel. So if you have the male gel, you need to use a teeny weeny amount so as not to get too much. So you just use a tiny bit twice a week, whereas Androfem is a concentration a bit more like women need, and you can use it every day. But ultimately, they are the same thing. They're both testosterone, but you can't get Androfem on the NHS. I think we've done most of those. Yes. If we've missed anything, go on.
Yeah, was about the Mirena coil.
Yes, okay.
Because I know a lot of women use that as for contraception, but often it can be part of the whole HRT toolkit as well, can't it?
Absolutely. So we talked about having estrogen for the symptoms, but progesterone to protect the lining of the womb. And some women will have the Mirena to protect the lining of the womb, and they don't need any additional progesterone as well. It's very good if you need contraception as well, because it does the job. It's very good if you've had troublesome periods, because it will stop the bleeding completely. It's you know, for most women it's brilliant. We've got a bit of a fan club for the Myrena over on Harley Street at home, actually. A lot of people have got a lot of good things to say about it, because it can be extremely convenient, because then you've got it in, it lasts for 5 years, and you just need to do your estrogen on top. However, some people understandably don't like the thought of it. It's not for them, but it's just to know it's an option, because it can be a very useful option.
So much more, again, it's choice
Absolutely.
all the way. Right.
Yeah.
If folk want to have, you know, a better chat with you, presumably they can get in touch with you by DM. They can contact both of us at Harley Street at Home, which is our Facebook page. Stand by, ladies, because harleystreetathome.com is coming. Our brand new website will be out later this summer. But for the moment, Dr. Zoe Schaedel, I am thrilled again. Thank you very much. Brilliant session. Your knowledge is just, it's like opening an HRT and menopause encyclopedia and just all this knowledge spills out. But it's, you know, I think why women love coming to see you so much is just, you know, you get it across in such an easily digestible format, and that's, you know, that's a real skill. So thank you,
Nigel. It's always so nice to speak to you, and I can't wait for next week.
Next week. Thanks a million, everybody. See you later.
Bye.